Hello, my name is Richard Moreau. I know I've met many of you over the years. I'm the Chief Government Relations Officer at ENA, and I'd like to welcome everyone and thank each of you for taking the time out of your busy schedule to be with us today at this webinar, which will cover not only our upcoming Day on the Hill event on April 28th and 29th, but we'll also discuss how you as an ENA member can positively influence government policies on Capitol Hill and in your states. I'll be joined today by Bill Schuler, who is a longtime ENA member and is the current Government Affairs Chair of the Oregon State Council. In addition to his state work, Bill is the chairman of ENA's Advocacy Advisory Council, which is a group of ENA members who share their expertise to help guide our government relations activities. Bill will be discussing ways you can get more involved and increase your effectiveness in public policy and advocacy. Following Bill, we're going to be joined by Rob Kramer, ENA's Director of Government Relations. Rob will be focusing on our upcoming Day on the Hill event, including an overview of our 3 legislative priorities for the congressional meetings, which take place on the second day of that event. We'll also leave time at the end of the webinar, as Nan mentioned, for any questions you may have. Just please submit them in the chat, and we will get to them at the end of the session. Thank you again for being with us today, and most of all, thanks for your advocacy on behalf of ENA and emergency nurses. So as we look to ENA's government relations activities, there are several factors that have allowed us to be as effective as we have been in our nation's capital. I think the most important thing is that we concentrate our efforts on issues that have the greatest impact on emergency nursing and the work environment for emergency nurses. By the latest count, there are more than 1,900 healthcare organizations that are lobbying in Washington, D.C. That is a lot of competition for the attention of lawmakers. Therefore, Rob and I know that we need to focus like a laser beam on raising awareness on the issues that make a difference to emergency nurses. With the help of ENA member advocates such as you, this allows us to punch above our weight and have significant influence on the legislative process. One of the things that we do here in Washington on behalf of ENA is build relationships with representatives, senators, and their staff. We want them to know about ENA and the important work of emergency nurses, as well as the bills that we support. This is something I would encourage you to try to do either with your elected officials in your state or with federal representatives, or just as importantly, and this cannot be overstated, how important it is to build relations with the staff that handles healthcare issues for members of Congress. Another strategy we utilize is working with coalitions. Simply put, with all the competing priorities on Capitol Hill, it is very hard to go alone and be successful. As a result, ENA partners with over 50 other nursing groups in Washington to advance our collective priorities. Depending on the issue, we also collaborate with other organizations, including many patient advocacy groups and physician groups, to increase our impact. All these efforts, of course, could not be successful without your involvement and support. I can explain the details of a piece of legislation or try to influence a legislative process in the House or Senate, but only you as emergency nurses can truly articulate the importance of public policies that affect emergency care for tens of millions of Americans. Your expertise and your stories make a real difference in the success of our advocacy efforts. So when it comes to identifying the specific issues which ENA supports and prioritizes, the most important resource by far is the ENA Public Policy Agenda. The PPA is updated every 2 years and it serves as a compilation of all our policy positions. It is found in the advocacy section of ENA's website. I recommend using the PPA as your guide to your own state government relations work, since it covers issues that span both federal and state matters. In fact, all 3 of our ENA Day on the Hill priorities, workplace violence, ED boarding, and nursing education, are all featured prominently in the public policy agenda. And so many of our other priorities, such as trauma care and injury prevention legislation, are also found in the PPA. As you look to determine what issues you could be advocating for in your own state, the best starting point is the ENA Public Policy Agenda. Now let's move from our top legislative issues to the question of how to actually get these bills enacted into law, which is the reason we're all here. When you get involved in advocacy in your state, the first thing to keep in mind is that nurses are viewed as some of the most trusted members of your community, and that your experiences and expertise are valuable assets for your representatives. Ultimately, our goal is to have elected officials view you and other ENA members as honest, reliable resources on policy affecting emergency care and emergency nursing. In terms of federal advocacy, there are several things you can do that are critical to the success of ENA's government relations work. The first and easiest way for ENA members and our supporters to weigh in with their members of Congress on our issues is to join the EN 411 Action Network. If you're not already registered, we ask you to visit the ENA website and sign up. It will take all of about 30 seconds to join. Through the EN 411 Action Network, ENA sends out regular action alerts highlighting major legislative priorities. EN 411 is one of the best ways for ENA advocates to communicate with legislators. Another great way to advance ENA's federal advocacy efforts is to try to attend ENA Day on the Hill. Day on the Hill 2025, which occurred last April, was a resounding success with 165 attendees from 44 states. Our members last year held over 150 meetings with representatives, senators, or their staff. And we know by tracking the list of co-sponsors, and we look at this really closely, what we found is that many of these meetings directly led to members of Congress making the decision to support and co-sponsor our legislative priorities. And that is the first step in getting our bills passed into law in Congress. This year, Day on the Hill, as many of you know already, will take place in Washington, D.C. and nearby Arlington, Virginia on April 28 and 29. We expect over 170 ENA members to be in attendance. Rob will be sharing more information about this event in just a couple of minutes. All right, I wanted to close my part of the webinar by giving an example of the power of advocacy and the crucial role that ENA members play in our successful government relations efforts. And that example is regarding Tyler's Law, a bill which has the goal of increasing the testing of fentanyl in emergency departments. This legislation originated in California back in 2022. During that year, ENA member Stephanie Jensen, who at the time was the government affairs chair in California, along with her colleagues at California ENA, became early and vocal supporters of Tyler's Law. For Stephanie, this was a professional undertaking, as she had seen firsthand the impact of opioid overdoses in her emergency department. But it was also personal for Stephanie. In the year before Stephanie began working on Tyler's Law, 3 students at her kids' high school had lost their lives due to fentanyl. Under Stephanie's leadership, California ENA members actively lobbied on behalf of the bill. She also worked with Tyler's mom, Julie Shamash, on raising awareness of Tyler's Law, which eventually led to the bill being passed by the state legislature and signed into law in August of 2022. This is an amazing accomplishment by California ENA. But Stephanie's work did not stop there. She contacted me about Tyler's Law and the need to pass a federal bill on this issue. This eventually led to the introduction of a federal version of Tyler's Law in the House of Representatives and the Senate. As you can see from the screen, their bills are slightly different, but they both go to the goal of increasing fentanyl testing in emergency departments. We helped identify bipartisan sponsors of the bill and met with over 100 congressional offices to increase the number of co-sponsors. I also worked with Julie Shamash and a larger group of moms and dads from across the country who had lost a child because of fentanyl. Their powerful and tragic stories, I believe, were instrumental in getting the United States Senate to pass Tyler's Law unanimously on March 23rd of this year. It was just another really great day for our success. This achievement was also aided by an amazing grassroots response by our own ENA members, who sent close to 600 letters to the representatives and senators through the EN 411 Action Network. Each of you can make a real, oh, I'm sorry. Even though we got it through the Senate, we still have our work to do on Tyler's Law. It has to pass the House before it can become law. But I believe the story of this bill and the success achieved so far highlights everything I've been saying about the critical role of ENA members in advancing our public policy goals. Each of you can make a real difference in improving the emergency nursing profession and improving the care provided to patients. Your advocacy can truly be life-changing and life-saving. So with that, I would like to now turn things over to Bill Schuler, who will discuss member engagement in our advocacy efforts. Bill?
Thank you, Richard. Hi, everybody. Thank you for attending the webinar today. I should not have looked at the who's attending because there are some rather large names, very well known in ENA, that it's a little intimidating, but thank you for attending and thank you for bearing with me. So I'm Bill Schuler. I am the current Advocacy Advisory Chairperson. This is my second time in the role, and I've been a member of the AAC, as we like to call it. I've been a member of the AAC for 6 years. So this is my sixth year. My background is I've been a nurse for 25 years. Before that, I had experience in EMS for quite a few years. And within my career as a nurse, most of that has been in the emergency department. And I took about a 9 year stint into patient safety, and now I am back at the bedside, but I'm working in urgent care, so a little less stressful environment than the emergency department. But it's been good for me. And I've been an ENA member since 2003. I kind of just bit the bullet and joined, and I wasn't necessarily the most active member when I started. I didn't really become active until I was invited to come to an ENA meeting in the state of Oregon. I grew up and started my career in Wisconsin, and then moved to Oregon in 2005. But yeah, member since 2003 and became more involved probably around 2007-ish, and then actually became way more involved in 2011. And how I got started in advocacy goes way back to about 2012. And the best way I can describe it is something happened in the ER, a workplace violence event happened. I don't remember the details. I don't remember exactly the specifics, but I remember how I felt in that nothing was being done. Nobody was talking about it. There was no follow-up. We didn't even have education back then. And so I was getting fired up, and I went online and I searched out all these violence prevention education courses, and you could become an instructor. You had to go for, maybe a week of training and spend a couple $1,000s. And I was ready to do that. I was ready to hit that button. And my manager came to me and said, Bill, we are starting a violence prevention program, and I've signed you up as an instructor. Now, I don't remember if we had a conversation about that before or not, but I became an instructor and then started training, mostly who we trained first was security and emergency department and behavioral health. And then we went to other units, and I helped manage that program for about almost 5 years. And then I switched roles and went into patient safety in a different health system and eventually helped with their violence prevention program. And, I got to grow and expand a violence prevention program. But so that is me helping within the system. And I took that passion for violence prevention. And in Oregon here, there was discussions about how do we expand our violence prevention, laws, because Oregon has had violence prevention in their laws for healthcare since about 2007. And we were looking for some expansion. We were looking for enhancing penalties for people who would assault a healthcare worker to make it a Class C felony in the state. And that's where we started. We started, with a group and meeting, and I volunteered. I'm like, hey, guys, I'll take this on. And that kind of like naturally led me into being the government affairs chair of the Oregon ENA. And I've been in that role since 2015. And yes, most of what we concentrated on has been violence prevention because the work is not complete. It will never be complete. And it's still ongoing, and we're having successes. We're having victories over the years. And sometimes we don't have victories. Sometimes it's just, it is what it is, and it sits and the bill dies, and we move on from there. But that's kind of how I became involved. And eventually, the Advocacy Advisory Council came about. I didn't know about it initially. And actually, one of my colleagues, a fellow Oregon ENA member, she's like, "Hey, I've been a part of this committee. Kathy Gantz is her name. She's like, you should really think about joining." So I'm like, what do I got to lose? So I put in my application. I got selected, and was part of the group through COVID and our day off the Hill that we've had, I think once or twice, and then trying to get back into it after COVID. And the group is really let me just say, the group keeps getting better and better. It grows year to year. We expand what we offer, how we support our fellow ENA colleagues, but also how we support fellow ENA presidents, as well as government affairs chairs. It I can't say enough good things about it. But here's what you see on your screen is what our charges are, and is to really look at public policy as it relates to advocacy, especially around emergency nursing. Not only the practice of emergency nursing, but the patients that we take care of and the environments that we practice in. And also, we generate ideas for program development and implementation, of course, related to government relations and advocacy. And we also assist in prioritizing the advocacy efforts. We look at even, we'll talk about Day on the Hill next. Robert will do that. And we talk about the priorities. What should we talk about? What should we bring forward to our legislative members this year? And we sit and we kind of chat about it. It's like, well, what are our members saying? What is the bedside caregiver saying? And that's really how we kind of come together and suggest what our priorities should be. And we can also provide assistance to the ENA State Council government affairs chairs. And we kind of have it divvied out. And that has been helpful. It's great to bounce ideas off each other. And if you're struggling with one thing, it's great to, hey, here's what's working in our state, or hey, we've worked on this e-bike safety law. Here's what you might want to consider. And it's interesting when you look at public policy, especially in your state. Some things are like, yeah, does that really fit our public policy agenda? Does that really? No, but maybe it might be a good idea to keep an eye on it. Or some things just pop up. You're like, hey, we can support that. Like an example would be this past year in Oregon. Our state allows for, school nurses to administer epinephrine, and it's within the law, but it was the auto injector. But now we have different versions of epinephrine we can give. And it was changing the wording of a law to be a pre-measured dose. So we have the Neffy, which is the intranasal form now. And it's like, I can simply write a letter in support of this bill, and it sailed through. It could be something that simple. All right, can I get the next slide? So these are the AAC members, and you can see that they are spread out across the United States. It's not all West Coast. It's not, all East Coast. There's some Midwest in there, some Southern, but a good mix. And some members have been on it for a couple years. Some members are brand new to the committee. Um, and I will just say, Kitty Rogers, she's a former Oregonian, so she can appreciate what we've done because she's seen some of the work we've done in Oregon. All right, next slide, please. So I just wanted to kind of hit on what is advocacy, and really the definition. It's a pleading, it's arguing for something, like a cause, an idea, a policy. You're actually acting, you're asking for active support of something. Now, it could be something you're personally interested in. It could be something that is your state council is supporting. We can, Nancy, you can probably just go ahead and click through all of these. Yeah, because the definition on the left-hand side, I pulled it from different sources, and it's pretty much the same. But lobbying is only one kind of advocacy, but not all advocacy is lobbying, but lobbying is advocacy. But you can see on the right-hand side that advocacy is different things. It's just not going before a congressperson. It can be going before your manager, your leadership at your hospital. It could be going before your your state board of nursing. It could be going before your ENA board. But we do a lot of educating. It could be educating the public on a certain topic. It could be performing research. It could be doing training. Just think of the Stop the Bleed training that has grown over the years, and it could even include litigation. Could be some form of advocacy of changing something that needs to be changed, that we feel needs to be changed. Okay, next slide, please. But usually, like I kind of alluded to, involvement usually stems from something that you care about or that you're passionate about. Now, does it have to be that way? No, it doesn't necessarily have to be. You could be asked to be involved or voluntold to be involved in something that actually gets you involved. But for me, like you heard my personal story, workplace violence prevention in the healthcare space is what I'm passionate about. It's what I care about. And it's what I've done quite a bit of my advocacy work on. And usually the involvement, what you advocate for, it's beneficial for emergency nurses. That could be addressing boarding, that could be, crowding, that could be looking at safety issues or practice issues. But usually if it benefits, in most cases, if it benefits the emergency nurse, it will benefit our patients too. So you think of, trying to address crowding and staffing issues is very common right now. We know that it has a trickle down effect. And the other thing that I've come to learn is that when I go in front of a legislator, um, I have to assume that people don't know the issues that is happening. It's amazing to me when I talk to people about violence in healthcare, how prevalent it is. I can pull out a lot of statistics, and sometimes those statistics don't even matter. I just need to tell a story of how it happened to somebody or even how it happened to me. And and then you pull out the statistics and they're like, wow, I didn't know it was that bad. I'm imagining that when we go in front of our legislators and talk about boarding, and the effects of boarding, and like you tell a story of, hey, we're boarding people in the emergency department. They're not going into the places where they should or need to go, and it's backing up, and there's nowhere to put the people who are coming in, and some of them are really sick. Telling them the story about how somebody died in the lobby, in the waiting room, while waiting for care, that has a tremendous impact. And of course, those don't make the news. They rarely make the news. So I make a good assumption that, people don't know necessarily the issues or what's happening in healthcare, what's happening in the emergency department, what's happening to our patients. So that is one way to, some ways, I should say, to get involved. So next slide, please. So if you're passionate or you are interested, it's very good to maybe connect with the government affairs chair at the state level. That's a good place to start. We are going to talk about advocacy on the federal level, but we cannot forget the state level because this is, you know, I advocate in Oregon because this is the state I practice in, right? And this is the state, this is where it affects me directly. It affects my practice, it affects my license, it affects my colleagues who I know and I care for. It affects the institution that I work for and I care for. So I know that some states even have their own day on the Hill where they will go to their state legislature and meetings and have meetings. We're not there yet in Oregon. I would like to get to that level, but I know that some states already have that established. Now, you will also find, I'll just kind of put this out there, that government affairs chairs or government affairs at the state level, they vary in participation. Some states don't even have a government affairs chair. Some have very well-established programs and that have been there for a while. Some states have government affair chairpersons that have been there for a long time, and some it just kind of changes year to year. But Thelma, I'm looking at you. You've been, involved in the state of Illinois for a long time. So, so yeah, that's one way. The easiest way I find is to sign up for the EN 411 and action alerts. Now this will come about on the federal level. So when we have an initiative or something that we are supporting through ENA, you will get that email. And this is very easy. This is very easy. You don't have to think about it very much. What comes is a preformed email, excuse me, explaining the topic, explaining the issue, what the bill number is, and there's an opportunity for you to add free text. So if you wanted to add your own story, if you wanted to add your own experience, you can do that in the EN 411 and the action alerts. Now, if you just look at it, you're like, yeah, I support this. I'm good. Click send, and it'll do it for you. Um, so that is also, you can participate. If that's the most that you participate in advocacy, that's okay. If you want to become the state government affairs chair, that too, that's okay too. Really, if you have the time to dedicate, great. You don't need to overdo it. You don't need to overthink it. Just even a small amount is pretty good. And then considering ENA's Day on the Hill in Washington, D.C., it's something we do every year. I've been attending probably since, I don't know, probably think since 2012 or so. I learn something new every time I go to ENA Day on the Hill. Whether I've been for the EN, a 101 class or the 201 class, there's something I learn every single time. And it's really great to catch up with my colleagues and see how they're doing in their states and even be able to support my other ENA colleagues. But what it really comes down to is if you're passionate, if you, let's say you don't even reach out to your government affairs chair at all, and you reach out to, look, my local representative here, my local senator in my state, I hear that they're involved here. Or, hey, I hear that they're a nurse. And you call up their office and be like, hey, is there anything I can help you with? Is there anything that is concerning you? One of the one of my proudest moments was when one of my representatives, he's not my representative in the state, but he is a representative, and he's a nurse. We actually worked at the same um, we worked at the same facility anyway, or same health system. And he texted me. I was like, wow, I've actually gotten here where I actually have a member of the, state house texting me and emailing me. This is great. And we've been able to work together on pushing forward some legislative efforts and been successful in that. But even so, just having a relaxed, organic conversation. Do you need to know all the stats? No. Do you need to know all the details? No. And if you don't, it's okay to say, I don't know. I don't know that. I can get back to you on that. Here's my card or here's my info. But having a relaxed, organic conversation and establishing some of those relationships, that's kind of a way to get started. It's just, talking about things is really a way to do that. So for the next slide, please, and I'll close with this. My encouragement for you is you don't have to deep dive on everything to be an advocate. You are an emergency nurse. You are practicing at the bedside. And let's say you're not practicing at the bedside anymore. You know the environment, you know what your colleagues are going through. You are already an expert. And don't forget that because I think it's like, oh, we get in front of a congressperson and it's like, we get stars in our eyes, or like we start thinking it's like, oh, wow, that they're shorter than I thought they were, or they're really tall, a lot taller than I thought, Senator Jeff Merkley, he's really tall. Um, but you are the expert. You already know a lot of these things, and you probably already advocate. You already speak up for your patients at work. You already speak up for, things that you like, this could be improved, or yeah, maybe we should do it this way. Can we consider this? You're already doing advocacy in your everyday life. It's just taking some of that and moving it over into either your state or the federal level. And I would just encourage you like, oh, it's easy to get discouraged by saying, I don't have the time to dedicate to it. I don't have the time to do this. I struggle with that. I would love if I could be a full-time government affairs chair and get paid for doing it, I would do it. But I already have a job, I have a family, I have other commitments. So I dedicate the time that I have and I do the best I can with what I can do. So that's my encouragement to you to get more involved because you probably already involved in something and you probably have the passion and you have the expertise to do it. So I just encourage you to get more involved in advocacy and public policy. And with that, I'm going to transition over to Rob Kramer who's going to take us through the next section.
Thanks, Bill. Everybody, it's just great to have Bill come on and share that information with us and, share some of his passion story and how he got involved in advocacy. And I really think it kind of does a great job to punctuate, what we're here today to talk about, which is, why advocacy is so important to our members, and why Richard and I and Bill are so dedicated to the work that we're doing on this front to improve the lives of emergency nurses and their patients. So what I'm going to do is I'm going to talk a little bit about Day on the Hill. I'm Rob Kramer. I'm the Director of Government Relations here at ENA. If you're a GA chair on this call, you probably heard from me before. But for anybody that's sort of new to advocacy, anybody that sort of was curious when they got the email about this call, we really want you to feel comfortable getting involved. We want you to know why your particular individual and collective efforts are so important to ENA. And really want to encourage everybody to get more involved, whether it's at home at your computer or traveling here to Washington, D.C. to come to Day on the Hill, as I'm getting ready to talk about. We just want to find a way to get all of our members who are interested in doing some of this work involved in any way that they're comfortable. So, first off, I just want to touch on a few points about why all of this is so important, and why Day on the Hill is important in sort of the scheme of things, seeing as it's really only one day of advocacy among an entire year of other opportunities. But, there are three main points I want to make. The first one is empowerment. And Day on the Hill really empowers our members to turn their frontline experience into real world change. And I think Richard did a good job of discussing some of the work that we do on the front end to kind of determine some of these priorities and some of our, bigger issues. But then Bill really kind of turned it on its head to say, this is why it's important. It's not enough for Richard and I, who have been here in Washington, D.C. We're both, veterans of Capitol Hill. We're not nurses, though. So it's especially important for you guys to come here to Washington, let them know, meaning your members of Congress and their staff, and letting them know how important these issues are to you is incredibly important to the success of the mission overall. So that's the first thing I want you to understand, is that you can turn what you're going through on a daily basis into real world change by letting the people that have the power to do something about it know. The second point I want to make is that you can really take advantage of the opportunity to engage in direct advocacy. And this is where you're there in front of them. You're there in front of the staff. You're sitting with the member of Congress. You're sharing your impactful stories with those lawmakers, with the staff that make recommendations to the lawmakers. And these are the people that have the power to change the law that will ultimately change the life that you experience at work and that the kind of care that your patients may experience. And then, of course, professional growth. This is something that is, I think, a little bit new for us this year, but we offer advocacy training in the experience through Day on the Hill. We think that this, of course, benefits nurses long after they leave Washington, D.C., not only in the experience that you pick up while you're here, but a lot of the tips that we provide during Day on the Hill are really applicable to any advocacy activities throughout the year. And really translate nicely to what you're doing at the state level. And then, of course, for this year, it is the first time we're going to be able to offer continuing education credits at Day on the Hill, and we're very much looking forward to continuing that trend moving forward. Nan, would you change the slide, please? So this year, of course, we're talking about Day on the Hill. It is occurring in about 2 weeks, April 28th and 29th, 2026. Next slide, please. The event itself is really our seminal premier advocacy event. It does take place annually here in Washington, D.C. I have been a part of, I believe, 10 of these so far, and I'm getting ready to execute the 11th that I've been a part of. But as Bill mentioned, he's been coming to them since 2012, so they've been going on even longer than myself or Richard have been here. So this year, it's your voice, but it's our collective impact, and we're going to be championing, emergency nursing issues here in Washington, D.C. over the course of those 2 days. Day on the Hill itself is typically about 175 members. That's what our cap has been. Registration is usually controlled by the state president. So if you're interested in attending future Days on the Hill, contacting your state president is probably your best bet as the event approaches. Dan, would you advance the slide? There are 2 days for Day on the Hill, specifically for the event itself. The first day, which is on Tuesday, is a day of training and support in terms of education. We teach you guys about what our legislative priorities are. We teach you about what to look for in Capitol Hill meetings. We provide instruction on the bills themselves and how we build the argument. We walk you through the materials that we use and really teach and train our advocates to go to Capitol Hill, to take the message, to take their stories and utilize them in the best way possible to achieve the successes that we need, which ultimately is usually the advancement of legislation. So day one this year, just to give you all a quick few highlights, we're going to be hosting an AAC panel on first wins. That'll be moderated by myself, but we'll have members of our Advocacy Advisory Council there to talk about, how they got their first win in advocacy, no matter how that happened, whether it was getting a member to co-sponsor a piece of legislation, getting a piece of legislation passed in their state, obtaining a difficult meeting. So we're going to be talking about that. We'll be doing a speed research workshop that will hopefully prepare our members for doing quick phone-based rapid fire research on members of Congress that they might be getting ready to meet with. This is to really kind of hone in on finding very specific details in a very short period of time. And of course, as I mentioned, we'll talk about our legislative priorities, which I will also review for you guys here in just a minute. Nan, if you'll advance the slide, day two is, of course, our actual day on the Hill. That's when attendees head off to Capitol Hill for meetings with members of Congress as well as their staff. You discuss these priorities, request co-sponsorships, build connections. Another opportunity is, I don't know when the last time you waited in line to get into an office building was, but you'll certainly have an opportunity to do it at Day on the Hill. Hopefully, if the foot traffic isn't too bad this year, the waits won't be too long. And then, of course, we always do a group photo on the Capitol Hill steps for those that have been participated in the past. It's always a great photo op. So that's just kind of a few of the quick highlights for this year. We encourage everyone to join us absolutely in 2027. We don't yet have the dates for that event, but as soon as we do, we'll be broadcasting those out to the larger ENA membership. Now let's touch very quickly on the legislative priorities. As Richard mentioned earlier, our priorities will typically mirror a lot of our big issues that we're dealing with, and then that translates down to specific pieces of legislation. So on the workplace violence front, we're supporting the Save Healthcare Workers Act this year that creates a federal crime of assaulting a emergency nurse or other healthcare worker. This is a federal criminal penalty that would be the first of its kind if it's enacted. And the bill does include options for enhanced penalties for those that commit these offenses during a declared emergency, such as a pandemic. This one kind of focuses on the workplace violence space. It has a great chance of passing during this Congress, and it's one that's supported by dozens of healthcare organizations, including the American Hospital Association, the American College of Emergency Physicians, and other organizations. Let's move on to the next one. On the boarding front, the Addressing Boarding and Crowding in the Emergency Department Act is another one of our priorities for this year. This would create a federal program that allows new funding to look into developing real-time hospital bed tracking systems to improve patient flow through your facilities. It also creates Medicare pilot programs to improve transitions for vulnerable populations, that ultimately create log jams within the system. And then it also directs a GAO study on hospital capacity management best practices. Usually when you see bills like this that will examine innovative approaches, they usually will accompany with a report at the end of it to tell everybody what the results of the programs were. And let's move on to the next one so we can get into any Q&A everybody has. The last one on our list for this year is very simple. It is the reauthorization of the Title VIII Nursing Workforce Development Programs. For anybody that's familiar with the Public Health Service Act, this is a big section of that law that is dedicated towards supporting nursing workforce development and training. These programs have been around for more than 60 years. They fund grants, scholarships, and loans that support training, education, and retention programs for nurses specifically. And although the programs have been around for 60 years, this is a reauthorization, and we do need legislative action in order to ensure that these programs continue. The appropriators in Congress can still provide money for these purposes, but in order for these programs to specifically continue as they are currently written, we need for the reauthorization to occur. So those are the three bills that we're supporting. If you're coming to Day on the Hill this year, you're going to get a lot more information about those over the course of those 2 days. But I just wanted to highlight those for anybody that may be interested in what we're doing this year or what priorities we may have. As we move into next year, I would really just encourage anybody that's interested to reach out to your state president, express your interest with them. Registration for Day on the Hill usually begins at the end of January, and it's usually done through the state presidents. And with that, I will turn it over to Dan, and I think he's got some QA already queued up for us.
As we get ready to do that, I did want to throw it to Richard and Bill. Any thoughts they have on Dan the Hill and their experiences that they want to share real briefly before we get into the question?
You know, the only thing I would add, Dan, I think Rob did a really good job of summarizing the 2-day event, is kind of what I alluded to earlier, which is Rob and I could talk about the bill numbers and the legislative process and talk to members of Congress about, how to get this bill done in Congress and how to get it passed. But they want to hear from frontline advocates such as yourselves. They want to hear the stories. They want to hear the passion. They want to hear the personal anecdotes that Rob and I cannot share, but that you as member advocates can share. And you can talk about specific things that happened in your emergency department that affected your livelihood or affected your patients. And I think that is the major takeaway from Day on the Hill is your voice makes a huge difference. We know nurses every year. There's a report out from Gallup that says we're the most trusted profession. Well, this is your opportunity to leverage that goodwill into making a difference for our top goals on Capitol Hill.
Bill, you want to add anything?
No, I just think of how like over the years how it's expanded. What we had to move the event because we needed more space. So that's a good thing, right? It's, advocacy can be a little tough because I mean we're trying to add it on to other things, but the fact that ENA has had to find different venues for it to expand is a good thing. And what we have, how many people signed up for this year?
There's 170 currently signed up.
That's huge, and it sounds like more and more people are getting more interested in public policy and advocacy. So that's a very big plus, and I actually look forward to it expanding even more. So,
Well, we did get some questions that were submitted during registration, and there were a few in the chat. So let's knock out a couple of the quick ones that were in the chat. Savannah had asked about some of the requirements to be a part of the AAC. So, Bill, I appreciate you putting in those sort of charges, those key points that people should consider if they want to take a part or they want to apply to be a part of AAC when the call for volunteers goes out later in the year. So if you're looking for that information, it is earlier in the chat, but certainly you can reach out to Bill or any of the AAC members if you have additional questions. Mary Lou had asked about the first day on the Hill, and it's funny because we had talked about that a little bit before we launched things here at the top of the hour. I think we determined that the first official day on the Hill in name was about 15 years ago, but ENA had been doing some lobbying or advocacy days, just more, I'll say a little less formally than what Day on the Hill has become over the years. So we do have a good history of that. And Richard was doing some work with our staff earlier today and talking about when he came on board about 13 years ago and really how the advocacy efforts really ramped up in that time frame. And we also got some perspectives from Bill about being a part of it. So that was one of the other questions that came in during the course of the chat. Richard, in registration, just kind of in general advocacy, there was a question that came in from Jacqueline about ENA's plans for adding forensic nursing topics, not only to Day on the Hill, but as part of the overall advocacy efforts, given the recent addition of our forensic nursing friends who have become a part of ENA in the last couple of weeks.
Yeah, absolutely. We've been tracking and advocating on behalf of forensic nurses for years now, especially SANES. We're going to be ramping up those efforts. We've been meeting almost on a weekly basis with people, the former IAFN staff and their president, to get up to speed on all their issues that they're advocating on behalf of. The big issue is really one of their top issues is going to happen next year when the Violence Against Women's Act is reauthorized for a 5-year period. That's a huge bill, and part of it includes grants for forensic nursing, education loans, and grants for students who want to enter forensic nursing. And that is a major source of aid and funding for people who go into that field. So that will be a focus of our support next year when that bill gets ramped up and needs to be passed by September 30th of 2027. But we'll continue also to learn about other issues, advocate on other important matters for that population.
And Richard, in the chat while you were talking, or Rob was talking about the nursing workforce grants, Natalie mentioned that a lot of forensic nursing education is provided by those same grants. So while our focus has certainly come from one perspective over the years, it's good to know that that also covers the forensic nursing side of things as well. Bill, looking at the member advocacy side of things, there's a question in registration about some of the best ways to invite folks to take part in the local or the state advocacy activities. And there was a mention in the chat earlier about a nurses' night at the legislature in North Carolina. So there are clearly events that go on that the legislature puts on, but certainly councils and chapters will do their part. What are some thoughts that you have, both having worked at the AAC, but the state level, for inviting and getting people, getting some energy around advocacy at those levels?
Yeah, maybe a couple things on that. Is like if you have a website, that's great. If you have social media, that's also a great way to like inform not only your members, but members of other states of what's happening and how they can get involved. Because when we've been in legislative sessions, we'll put out a call to like, hey, we need your help. Can you write your legislator? Please find your legislator. Here's a form letter that you could use, but can you please tell them how important this is to you? And you could do that with your membership, and you could ask specific people to do that as well. But I think one of the hard things for state councils to do is to communicate with their membership. But social media is definitely one way that you can do that. You can get some campaigns going. But that's what comes to kind of the top of mind is how are you communicating with your members and how you asking them to get involved, really.
Richard, coming back to our asks for this year, in registration, there was a question to elaborate a little bit on the benefits of advocating for the Safe Healthcare Worker Act when your state has a bill that allows assault, or has a law that allows assault to be a felony with commensurate imprisonment or other punishments of that long. They're looking for some tips on how you can relate those two things together while knowing that you also may have some of those same things already in play within your home state.
Yeah. So that's a great question, Dan. Out of the 50 states, there's still about 18 or 19 that do not have a felony law. So that federal law that we're trying to implement would fill the gap to those 18 or 19 states that have so far failed to implement that kind of statute. But even more importantly, a lot of states are overburdened with too many criminal cases to prosecute. A lot of local DAs are underfunded and understaffed, and they don't adequately prosecute, especially cases of workplace violence in the healthcare setting, and especially in emergency departments. And this bill here, if an assault takes place in an emergency department, prosecutors will have the option. Do we want to prosecute at the local level through our DA, or do we want to prosecute at the federal level? And if your DA is overburdened or doesn't have the resources, you can always go back to the option of going to your local federal prosecutor. And under this law, once it's hopefully enacted into law in the coming years, they can prosecute at the federal level. So it's really a backstop for overburdened local prosecutors. And that's really important because we've heard so many times about nurses who file reports, who want investigations and just don't see enough action by their local prosecutors, not because they don't want to prosecute, but maybe they have too many other issues to deal with or too many other prosecutions. So it's really important to have that federal bill as well as the state bills on assaulting healthcare workers.
So don't have any other questions, but I'll just make a note as something was referenced earlier, the question about some of the scheduling for Day on the Hill. I'll point out that yesterday all registered attendees should have received an email relating to the ENA Events app, which went live yesterday. So within the app, there's a number of things you can do, but most importantly, you can see the schedule and the timing for things. And obviously, connect with other attendees. That's where you'll work through for your CEs. You'll get other important information, as we continue to update things here in the next 2 weeks. So just wanted to make sure I gave a shout out to the app because it's proven to be a great resource for all ENA events, but particularly when you're getting closer to something like Day on the Hill. And of course, Bill was talking about the big names that were in the room. And Thelma's history within advocacy, she did share in the chat that a quote unquote Day on the Hill has been conducted probably since the early 2000s. So we know advocacy has a long history here, whether it's called Day on the Hill or not. So thanks to Thelma for offering some of the institutional knowledge here as well. But that is it for the questions and some of the comments that were submitted. So I'll give it back to Rob here to close this out.
Thanks, Dan. There's still about 95 people on the call. Thank you all very much for joining us today. We really hope that this serves as kind of first salvo in providing regular updates on some of our advocacy work and some of the results of your efforts out there in the field. We really look forward to seeing everybody that's going to be at Day on the Hill in a couple of weeks. Bring your energy. We're going to need it this year. And for everybody else who hasn't done it before and is interested, jump into your government affairs committee at your state level, get involved, and let us know how we can help you moving forward into next year.
I just also want to add, if anybody has any questions about not just Day on the Hill, but want to get more involved in your state or federal advocacy and have a question about the process or how to do it, feel free to reach out to Rob and myself via email. It's firstname.lastname@ena.org. And we'll get back to you. We'd love to see your engagement, as we saw in Tyler's Law. Some of our best advocacy starts by ENA members getting engaged in government relations and then taking that effort and that passion and handing it off to us and working collaboratively to get bills passed. So just reach out to us anytime if you have any questions or want to get started in government relations.